One, this is the first video. We are beginning with the NEET PG series. So the first topic which we will cover is cellular adaptation. We will discuss about the MCQs, the theory behind it, and this video is not only important for the NEET PG aspirants, it's also important for the undergraduate students who want to get a good grasp of the knowledge regarding the cellular adaptation. Now, so going to the first question, we will discuss the question and then we will discuss the theory behind it. So the first question regarding the cellular adaptation is that all are cellular adaptation except, now you have four choices. So here hyperplasia, hypertrophy, metaplasia, necrosis. This is a very easy question. So here you have to just know what are the cellular adaptations. So cellular adaptation means cell is adapting to something. So if you know cellular adaptation, there is atrophy, you have your hyperplasia, okay, you have hypertrophy, and the metaplasia is also a type of cellular adaptation. What is not a cellular adaptation is necrosis. So necrosis is a type of cell death. So cell death, you have apoptosis, you have necrosis. So these two are cell death. So obviously the answer will be D, necrosis. Okay, now going to another question. This is more question which is coming nowadays, that is the pictorial representation. You have a figure, you have description. Okay, here you have to see that mostly the diagnosis, the answer will be formed on the description only. So the question here is 60-year-old female complains of discharge per vaginum. On examination, the cervix appears erythematous. Cervical biopsy was done which shows the following microscopic picture. Describe the pathology. So before discussing the answer, so you should know 2-3 things, that whenever there is irritation in the body, okay, there is exposure to any chemical such as tobacco, smoke. So what happens is, the normal, if the lining epithelium is columnar, it will change to squamous epithelium, and this is seen in two organs mainly. You have lungs and you have cervix. So in these two, what will happen is, the irritation, like in the cervix, because of the prolapse, so this irritation, exposure to the environment, this will lead to change of the epithelium from columnar to squamous. Also in lungs also, if the person is consuming tobacco, so what will happen is the change of epithelium from pseudostratified columnar to again squamous epithelium. So here the answer will be squamous metaplasia, that is the change of one epithelium. Metaplasia means the change of one epithelium to another epithelium. So that is metaplasia. And squamous means that now this epithelium is gone into squamous. Okay, earlier it was columnar, now it has changed into squamous, that is squamous metaplasia. So here you can see, so if you see columnar cells, so columnar cells will be tall, will have nucleus towards the bottom. So this is your columnar cell. So here you can see the glands, okay, long glands are present, and they all have cells. Okay, these cells have nuclei towards the bottom. So this is the columnar epithelium normally which is present in the cervix, okay, in the endocervix. Now here you can see this is the metaplastic zone. Okay, this is the squamous metaplasia which is taking place. The normal ectocervix is lined by squamous only, but here you can see the change of epithelium. This is the metaplasia and this is the squamous metaplasia. So this is therefore the answer is squamous metaplasia over here. You can ask your queries in the comment box also. Okay, now question number 3, decrease in cell size is, so you have options, you have atrophy, hyperplasia, hypertrophy and apoptosis. Now apoptosis we already discussed that it is a type of cell death. Hyperplasia means increase in the number of cells. Hypertrophy means increase in size of cell, and your atrophy means decrease in either number of cells or size of cells. So this is the atrophy. So the answer will be atrophy. So What is atrophy? Atrophy is decrease in the size or the number of cells and the weight of the organ due to the decrease in the size and number. So here you can see, if you get a question, that person, there was an injury to the person, okay, and there is denervation, okay. So after denervation, what happens? The normal skeletal muscle, if they look so full, okay, you can see here they're so beautiful, okay. So here you can see they are atrophied, they are small, okay. The muscle bundles have shrunken in size, so this is atrophy, okay. So normally you can see the skeletal muscle, this is the normal picture, and side by side you can see the abnormal picture. Here the skeletal muscles have shrunken in size. So this is, can also be asked. So hypertrophy is increase in the size of the individual cells in response to any stimulus or injury, such as if the person is exercising, okay, is into bodybuilding. So what will happen is the skeletal muscle, okay, here you can see the skeletal muscle has increased in size, okay, the individual, this is increased in size, this is hypertrophy. Then hyperplasia is increase in number of cells. It can be pathological, it can be physiological. So like in lactation, there is increase in the number of cells, okay. In prostatic hyperplasia, there is increase in the number of cells. So here you can see there is one example of hyperplasia and hypertrophy, that is the myometrium. So this is the myometrium of the uterus. So you can see in the pregnancy, what happens is there is hyperplasia and hypertrophy of the uterus, okay. So this is a gravid uterus, that is pregnancy has taken place. So gravid uterus, so you can see there is increase in the size of the cell, okay. Microscopically if you see it, there will be increase in the number of cells also. Now going to the question number 5, metaplasia arises from reprogramming of. So here this is on base of theory only, that metaplasia is known that there is reprogramming itself of the stem cells, not of the mature cells, okay. The stem cells, they only reprogram, therefore the change of epithelium from one to another takes place, that is the metaplasia. Now question number 6, 40 years obese female has experienced heartburn from gastric reflux for 5 years after large meals. She undergoes upper GI endoscopy and biopsy has been obtained, okay. Which of the following changes you see? So here in the history, firstly, before going to the options, you know the patient is suffering from the gastric GRED, that is gastroesophageal reflux disease, okay. This is the only thing which you should see from this, okay. So the patient is suffering from GRD. Now the options are that what is happening in patient is there is columnar metaplasia, there is goblet cell hyperplasia, lamina propria atrophy, or squamous dysplasia. So normally the esophagus is lined by squamous epithelium. Here it is different, okay. Don't confuse with the cervix or lung part, okay. Here normally the your esophagus is lined by squamous epithelium. Now what happens here is, because of gastroesophageal reflux disease, there is two type of metaplasia which takes place. There is columnar metaplasia along with intestinal metaplasia, okay. This is known as your Barrett's disease of the esophagus, okay. I have a separate video on this also, I will link that video also. This is known as Barrett's esophagus. So what happens because of GERD, because of reflux, what happens is the squamous epithelium, it changes from squamous into the columnar epithelium along with the intestinal metaplasia. So intestinal metaplasia takes place. In the intestine, what is characteristically seen is the goblet cells. So you can see the empty spaces over here. These are all the goblet cells. So this is a goblet cell hyperplasia. This is the correct answer. The correct answer is columnar metaplasia, not goblet cell hyperplasia, because this is metaplasia which is taking place. This is not the only hyperplasia which is taking place, okay. So this is the change in the epithelium. Normally this epithelium is not seen over here, the intestinal epithelium. Intestinal epithelium will be seen in intestine. So here the presence of goblet cells along with the columnar epithelium is known as Barrett's esophagus, and this is characteristic in the person who is suffering from chronic GERD. Going to question number 7, an example of metaplasia is. So in this now only we have discussed, so the answer will be Barrett's. Okay, so sin is carcinoma in situ. Okay, so carcinoma is not a type of metaplasia. Metaplasia is just change of one mature epithelium to another mature epithelium, that is the metaplasia. Adenoma is benign tumor, okay, benign glandular tumor. Then carcinoid is again a type of tumor. So only Barrett's is a type of metaplasia. So what is metaplasia? Is the reversible change in which one mature epithelium, okay, here remember one thing, not only epithelium, mesenchymal component also. Okay, if one epithelium can change into another epithelium, even one mesenchymal type tissue can change into another mesenchymal tissue. So that is metaplasia. And very good example of metaplasia, you should remember 2-3 examples very well. First is in the lungs, where you see pseudostratified columnar epithelium going into squamous epithelium. In the cervix, where you see again columnar epithelium going to squamous, and then your Barrett's esophagus. These are 2-3 very important examples of the metaplasia. So this was all about the cellular adaptations. We will discuss about cellular injury in the next video. I would appreciate if you ask any queries in the comment box. I will respond to that. Thanks for watching this video. Thank you.